Imagine this for a moment. It's a quiet afternoon. The house is still. Maybe the television is on in the background, or you're sitting in your favorite chair, reading or resting your eyes. Everything feels normal. And then, without warning, something shifts inside your body. A strange pressure builds in your chest. Not sharp at first, just heavy, uncomfortable. You try to ignore it, but then your breathing changes. It feels shallow, tight. Your left arm starts to tingle, then slowly goes numb. You take a deeper breath, but it doesn't help. Your heart feels like it's racing and slowing at the same time. A wave of fear washes over you as one thought hits harder than anything else. You're alone, and something is very wrong. This moment is more common than most people realize. Every single year, hundreds of thousands of adults over the age of 60 experience a heart attack while they are completely by themselves. No spouse in the next room, no family member nearby, no one to notice the warning signs or call for help. And the most frightening part isn't the heart attack itself. It's the confusion that follows, the hesitation, the not knowing what to do first. Because in those first few minutes, the difference between survival and tragedy often comes down to a handful of decisions made under intense stress. What most people don't know is that survival during a heart attack isn't only about how fast an ambulance arrives. It's about what happens in the first 60 seconds. That first minute is when your body either begins to stabilize or spirals further into danger. And according to large-scale medical research, people who know exactly what to do during that first minute can dramatically increase their chances of survival. The problem is, almost no one is taught what those steps actually are. Doctors assume someone will be nearby. Emergency services assume the patient can communicate clearly. Families assume they'll be together when something happens. But reality doesn't work that way. Heart attacks often strike when you're alone, quiet, and unprepared. And panic is the enemy. Panic clouds judgment. Panic wastes time. Panic causes people to make the wrong move or freeze entirely. That's why what you're about to learn matters so much. Today, you're going to learn the 7 life-saving steps doctors urge people over 60 to understand before a heart attack ever happens. These are not internet myths. They are not folk remedies. They are principles based on how the heart, brain, and nervous system actually respond under stress. And they're designed specifically for people who may be alone when symptoms begin. But before we get to the steps themselves, you need to understand something critical. Most people imagine a heart attack as sudden, dramatic, and obvious. Crushing chest pain, collapse, loss of consciousness. But in adults over 60, heart attacks often present very differently. The pain may be mild at first. It may feel like indigestion, a sore shoulder, fatigue, shortness of breath that comes and goes. Many people ignore these signs because they don't match what they expect a heart attack to feel like. That delay is dangerous. Studies consistently show that the longer someone waits to act, the more damage occurs to the heart muscle, and once heart tissue is damaged, it doesn't regenerate. Every minute without oxygen increases the risk of long-term disability or death. That's why the goal of everything you're about to hear is simple: buy time, keep blood flowing, stay conscious, get help as fast as possible. Let's start with the first and most important principle, because everything else depends on it. The moment you feel something is wrong, you must accept that it could be a heart attack. This sounds obvious, but psychologically, it's one of the hardest steps. People deny what's happening. They rationalize. They tell themselves it's heartburn, stress, or fatigue. They wait to see if it passes. That delay can cost precious minutes. The truth is this: it is far safer to assume a heart attack and be wrong than to assume it's nothing and be right. Your heart does not send warning signals for no reason. Pressure, tightness, pain radiating to the arm, jaw, or back, sudden sweating, nausea, dizziness, or unexplained fatigue are all red flags. Even if they come and go, they matter. Even if they're mild, they matter. The moment you recognize these symptoms, your focus should shift from diagnosing yourself to protecting your life. This is where step 1 begins. The first life-saving step is establishing communication immediately. When a heart attack begins, the brain starts receiving less oxygen. Within seconds, thinking becomes slower. Within a minute, confusion can set in. Within a few minutes, speech can become difficult. That's why waiting to see how you feel is one of the most dangerous things you can do. The first thing you should do is make sure help can reach you. That means calling emergency services immediately. Not after you sit down, not after you take a breath, not after you search online. Right away. If you have a phone in your hand, call emergency services immediately and put the phone on speaker. Do not hang up. Even if you think you can manage, stay connected. Dispatchers are trained to guide you through the next steps and can send help even if you stop responding. But here's something most people don't realize. When a heart attack begins, fine motor skills deteriorate quickly. Fingers shake, coordination drops, vision can blur. That's why relying on memory in that moment is risky. This is why having emergency numbers pre-programmed or using voice commands if your phone supports them can make a life or death difference. It's also why keeping your phone within reach at all times, especially at night, is critical. Many fatal heart attacks occur during sleep or late evening hours when phones are charging in another room. Getting up to retrieve a phone while your heart is failing can be impossible. Once emergency services are contacted, the next priority is positioning your body correctly. Most people instinctively lie down flat when they feel unwell. During a heart attack, this can actually make things worse. Lying flat increases the workload on the heart and can worsen breathing. The better position is semi-upright. Sit with your back supported at an angle, knees bent, feet flat on the floor if possible. This position reduces strain on the heart and allows your lungs to expand more easily. It also helps prevent blood from pooling in the lungs, which can cause a frightening sensation of drowning. If you feel lightheaded or faint, lower yourself carefully to the ground rather than collapsing. If possible, roll onto your side. This position helps keep the airway clear if nausea or vomiting occurs, which is common during cardiac events. At this stage, it's also important to make your surroundings safe. Loosen tight clothing. Open a window if the room feels stuffy. Keep the environment calm and cool. Panic raises heart rate and blood pressure, which increases the heart's demand for oxygen. Calmness, even forced calmness, reduces that demand. This brings us to one of the most overlooked but powerful tools you have in this moment: your breathing. When fear hits, the body automatically switches into rapid, shallow breathing. This is a stress response designed for short bursts of danger, but during a heart attack, it backfires. Shallow breathing reduces oxygen delivery and increases strain on the heart. Slow, controlled breathing can significantly reduce the workload on your heart. The goal is not to breathe deeply or forcefully, but slowly and steadily. Inhale through your nose for several seconds, allowing your belly to expand. Hold briefly. Then exhale slowly through your mouth, longer than your inhale. This pattern activates the parasympathetic nervous system, which helps slow the heart rate and reduce blood pressure. Even a small reduction in heart rate can preserve precious heart muscle during an attack. This breathing also keeps you focused and grounded, reducing panic and helping you stay conscious longer. Many survivors report that controlled breathing was the one thing that helped them stay alert long enough for help to arrive. Now, while you're breathing and waiting for help, there is another critical action that can dramatically improve outcomes for many people: aspirin. Aspirin works by thinning the blood and preventing clots from growing larger. Since most heart attacks are caused by a clot blocking blood flow to the heart, aspirin can slow or limit the damage. However, timing and method matter. If you are not allergic to aspirin and have not been told by a doctor to avoid it, chewing a standard aspirin tablet can help it work faster. Chewing allows the medication to enter the bloodstream more quickly than swallowing it whole. The typical dose used in emergencies is one full-strength tablet or multiple low-dose tablets equaling the same amount. The key is to chew it thoroughly before swallowing. This does not replace medical care. It does not stop a heart attack entirely, but it can buy time and reduce damage while help is on the way. If you've already been prescribed heart medications, this is also the moment to use them exactly as directed by your doctor. Some people carry nitroglycerin for chest pain. If that applies to you, it should only be used as prescribed and only while seated or lying down, as it can cause sudden drops in blood pressure. At this point, you may be wondering why all of this emphasis is placed on the first few minutes. The reason is simple. Heart muscle begins to suffer irreversible damage within minutes of oxygen deprivation. The faster blood flow is restored, the better the outcome. Everything you're doing right now is about slowing that damage and keeping your body stable until professionals arrive. And here's something important to understand: survival is not just about staying alive in the moment. It's about how much heart function you retain afterward. The difference between acting quickly and waiting too long can mean the difference between returning to a normal life or living with chronic heart failure. That's why what comes next is so important. In the next section, you're going to learn several lesser-known but critically important actions that can dramatically increase your odds of survival when you're alone. These are steps most people have never been told, yet they are supported by medical understanding and real-world outcomes. They involve how you prepare your environment, how you signal for help, and how you avoid the most common mistakes people make during a cardiac emergency. But before we move on, take a moment to let this sink in. You don't need to be a doctor to survive a heart attack. You don't need special equipment. You don't need perfect conditions. You need awareness. You need preparation. And you need to act without hesitation. Everything you've learned so far forms the foundation. What comes next builds on it, and it could save your life. When people think about surviving a heart attack, they usually imagine dramatic rescues or high-tech hospital interventions. What almost no one realizes is that survival often hinges on a series of quiet, almost invisible decisions made in the first few minutes. Decisions that don't look heroic but are incredibly powerful. This is where most people make critical mistakes. They wait, they hesitate, they second-guess themselves, they underestimate what's happening, and in doing so, they lose time they can never get back. One of the most dangerous misconceptions is believing that if you're still conscious, the situation can't be that serious. In reality, many heart attack victims remain awake and aware for several minutes, sometimes much longer, even as their heart is being damaged. This false sense of stability leads people to delay calling for help or to try to ride it out. That instinct is deadly. This is why the next step is so important and yet so rarely discussed. You must make it easy for help to reach you, not eventually, immediately. This means unlocking your door. It sounds simple, almost too simple to matter, but emergency responders consistently report that one of the biggest causes of delayed treatment is not traffic or distance, it's locked doors. When paramedics arrive and cannot enter, precious minutes are lost. They may have to force entry. They may have to wait for police. They may have to search for access points. During that time, your heart continues to suffer. If you are able to stand or walk even briefly, your priority should be to unlock your door and, if possible, leave it slightly open. If you live in an apartment, unlock the main door and your unit door. If you have a security system, disable it if you can. This may feel counterintuitive. Your instinct might be to stay seated or lie down. But if you can safely take a few steps to ensure access, doing so could save your life. Many survivors later say the same thing. They had no idea how quickly strength fades during a heart attack. What feels manageable in the first minute may be impossible just minutes later. Once the door is unlocked, return to your safe position and focus on breathing and staying conscious. Another overlooked but critical step is making yourself visible and audible. If you live alone, emergency responders may not immediately know which home or apartment belongs to the person in distress. Turning on lights, opening curtains, or creating visual cues can help them locate you faster. If you have the ability, leave a light on near the entrance. If it's daytime, open a curtain or blind. If you live in an apartment complex, turning on porch lights or hallway lights can help responders identify your location more quickly. Sound also matters. If you have a whistle, keep it nearby. If you lose your voice or become too weak to speak, making noise may be your only way to alert responders who are nearby. Even weak sounds can help them find you faster. These small actions might feel insignificant, but they can shave minutes off response time. And in a heart attack, minutes matter more than anything else. Now, let's talk about one of the most misunderstood aspects of heart attacks movement. People often assume they should lie completely still. Others believe they should try to walk it off. Both extremes can be dangerous. The truth lies in between. You should avoid exertion. Walking around, climbing stairs, or trying to push through symptoms places additional strain on the heart. But you also shouldn't collapse flat unless you feel faint. The goal is to stay still, supported, and upright enough to breathe comfortably. Think of your body like an engine under stress. The more you demand from it, the harder it has to work. Your job is to reduce demand, not increase it. That means no pacing, no rushing, no unnecessary movement. It also means avoiding anything that increases adrenaline. Fear, panic, and agitation all trigger the release of stress hormones that raise heart rate and blood pressure. This creates a vicious cycle where the heart is forced to work harder at the exact moment it's struggling. This is why controlling your mind is just as important as controlling your body. One powerful technique that many survivors credit with keeping them alive is mental anchoring. This involves focusing your attention on something simple and repetitive: your breathing, counting slowly, or repeating a calming phrase in your mind. It sounds almost too simple, but it has a real physiological effect. It reduces panic, lowers heart rate, and stabilizes breathing. Even telling yourself, calmly and deliberately, "Help is coming. I am staying calm. I am breathing slowly," can make a measurable difference. Your brain listens to what you tell it. Now, there's another critical mistake people often make during a heart attack: trying to drive themselves to the hospital. This is extremely dangerous. Even if you feel capable at first, symptoms can escalate suddenly. Loss of consciousness, dizziness, or impaired vision can occur without warning. This puts not only your life at risk, but the lives of others on the road. Emergency medical services are equipped to treat you the moment they arrive. They can provide oxygen, medication, monitoring, and rapid transport. You cannot do that for yourself. Driving during a heart attack has resulted in countless accidents, many fatal. No matter how close the hospital is, calling emergency services is always the safer choice. At this point, you might be thinking, what if I live far from help? What if response times are long? This is where preparation makes all the difference. People who prepare in advance survive at far higher rates than those who don't. Preparation doesn't mean living in fear. It means making simple adjustments that remove obstacles during an emergency. For example, keeping a list of medications and medical conditions visible in your home. Emergency responders look for this information. If you're unable to speak, it can guide their treatment decisions immediately. It also means keeping important medications in consistent, easily accessible locations, not scattered, not hidden away, not stored somewhere difficult to reach. It means having a phone charger nearby so your phone doesn't die when you need it most. It means telling at least one trusted person, neighbor, friend, or family member that you live alone and may need help someday. Many lives have been saved simply because someone checked in when they didn't hear from someone at their usual time. These are small things, but they create a safety net. Now, there's something else that deserves attention because it's often misunderstood and rarely explained properly. Pain is not always the main symptom of a heart attack. In older adults, symptoms are often subtle. Instead of sharp chest pain, you might feel pressure, discomfort, or a sense of fullness. You might feel unusually tired, lightheaded, or nauseated. You might feel short of breath without any obvious cause. Some people experience pain in the jaw, neck, shoulders, or back instead of the chest. Others feel indigestion or heartburn, like sensations that don't go away. Because these symptoms don't match the dramatic portrayals people expect, they're often ignored. If something feels off and it doesn't improve quickly, that's enough reason to act. Another critical factor is timing. Heart attacks often happen in the early morning hours, when blood pressure naturally rises and the heart transitions from rest to activity. They also commonly occur during periods of emotional stress, exertion, or illness. This means the moment you wake up feeling unusual should never be dismissed. Now, let's address something very important: what not to do. Do not drink alcohol. Do not smoke. Do not take unknown medications. Do not lie flat and hope it passes. Do not delay calling for help to avoid embarrassment or inconvenience. No one has ever regretted calling for help too early. Many people have regretted waiting too long. Another dangerous myth is that if symptoms come and go, the danger has passed. In reality, fluctuating symptoms can indicate unstable blood flow, which is extremely dangerous. Temporary relief does not mean the problem is gone. This is especially true for people with diabetes, high blood pressure, or previous heart conditions. In these individuals, symptoms may be muted or atypical, making delays even more dangerous. Now let's talk briefly about mental preparation, because this is something almost no one discusses. When a heart attack begins, your mind may try to minimize what's happening. You might think about your family, your responsibilities, or how inconvenient it would be to go to the hospital. You might tell yourself you'll wait 10 minutes and see if it passes. This is a natural psychological defense mechanism, but survival requires overriding that instinct. The people who survive most often are not the ones who are strongest or healthiest. They are the ones who act quickly and decisively, even when they feel uncertain. They treat uncertainty as a reason to act, not a reason to wait. They don't argue with symptoms. They don't negotiate with discomfort. They respond. That mindset saves lives. Now, in the next section, we're going to talk about the most powerful tools you can use if symptoms escalate, tools that involve medications, positioning, and very specific actions that can dramatically influence outcomes when used correctly. These are steps many doctors assume patients already know, but most people never learn. They can make the difference between a manageable cardiac event and a life-altering one. What you've learned so far builds the foundation. What comes next strengthens it. And it's information every person over 60 should know before they ever need it. Now we come to the final and most critical phase of survival, the part that separates preparation from outcome and knowledge from action. By this point, you understand the importance of recognizing symptoms early, calling for help immediately, positioning your body correctly, controlling your breathing, and avoiding the common mistakes that cost precious minutes. But there is one more layer to this that many people never learn until it's too late: how to work with your body rather than against it during the peak of a cardiac event. This is where clarity matters most. When a heart attack is underway, your body is under immense strain. Blood flow is restricted. Oxygen levels drop. The heart struggles to pump efficiently. Every system in your body responds to this emergency in different ways. Your job is not to fix the problem. That's what medical professionals are for. Your job is to stabilize, preserve, and survive. One of the most powerful tools you have at this stage is awareness of your own limits. Many people make the mistake of trying to push through the discomfort. They attempt to stand, walk, or perform tasks that their body is no longer capable of handling. This often leads to sudden collapse, injury, or loss of consciousness. Instead, you should focus on conserving energy. Stay as still as possible while maintaining a position that supports breathing. Avoid unnecessary movement. Keep your arms and legs relaxed. Let your body use what energy it has to maintain vital functions rather than movement. At the same time, stay mentally alert. Talk to emergency dispatchers if you are on the phone. Answer questions clearly but briefly. If you're alone and not on a call, speak out loud occasionally. Hearing your own voice can help you stay conscious and grounded. It also helps you monitor whether your speech is becoming slurred or difficult, which can be important information for responders. Another key factor during this phase is temperature. If you feel cold, do not bundle yourself tightly in blankets. Overheating increases cardiac workload. Instead, aim for a neutral temperature. If you are sweating, this is a common symptom and not something to panic about. Simply remain comfortable and still. If you begin to feel nauseated, turn your head to the side. Vomiting can occur during a heart attack, and protecting your airway is essential. This is another reason why lying flat on your back is not ideal. Now, let's talk about something extremely important that many people misunderstand: medication timing. If you have been prescribed heart medication such as nitroglycerin, it must be used exactly as directed by your physician. Taking more than recommended does not improve outcomes and can cause dangerous drops in blood pressure. Nitroglycerin works by dilating blood vessels, reducing the heart's workload. When taken correctly, it can relieve chest pain and improve blood flow, but it is not a cure and it does not replace emergency care. If you take it and symptoms improve slightly, do not assume the danger has passed. This is one of the most common and dangerous mistakes. Relief does not mean resolution. It simply means the medication has temporarily reduced strain. Emergency services must still be contacted. If you have not been prescribed nitroglycerin, do not take someone else's. This can be extremely dangerous, especially if you have low blood pressure or are taking medications for erectile dysfunction, which can interact dangerously with nitrates. Aspirin, on the other hand, is generally safe for most people when taken during a suspected heart attack, unless you have a known allergy or have been specifically advised not to take it. Chewing allows faster absorption, which can be critical in slowing clot formation. At this stage, it's also important to understand that fear itself can worsen a heart attack. Fear increases adrenaline. Adrenaline raises heart rate. Increased heart rate increases oxygen demand. This cycle can accelerate damage. That's why mental control is not just psychological, it's physiological. Focusing on slow breathing, repeating calming phrases, and keeping your thoughts steady can significantly reduce strain on the heart. Many survivors describe entering a kind of focused calm once they stopped fighting the sensation and instead focused on staying present. This doesn't mean giving up. It means working with your body instead of against it. As time passes, you may feel waves of discomfort come and go. You may feel moments of clarity followed by weakness. This is normal during a cardiac event. What matters is that you remain as still, calm, and aware as possible until help arrives. And when help does arrive, your preparation continues to matter. If you are conscious, tell responders exactly what you felt when it started and what you did. Mention any medications you've taken, including aspirin or nitroglycerin. Show them any medical information you have prepared. This helps them treat you faster and more effectively. If you are unable to speak, having visible information, medication lists, emergency contacts, medical conditions can be life-saving. This is why preparation before anything happens is so important. It's not about fear. It's about respect for reality. Heart disease remains one of the leading causes of death worldwide, especially among adults over 60. But survival rates improve dramatically when people know what to do and act quickly. The tragedy is not that heart attacks happen. The tragedy is that many people don't survive because they didn't know what steps to take. Everything you've learned in this video exists for one reason: to give you a fighting chance. To help you stay alive long enough for medical professionals to do their job. To help you reduce damage, preserve heart function, and return to your life. And here's the most important truth of all. Survival is not about being lucky. It's about being prepared. You don't need medical training. You don't need expensive equipment. You don't need to memorize complex procedures. You just need to remember a few critical principles: recognize symptoms early. Call for help immediately. Position your body correctly. Control your breathing. Avoid unnecessary movement. Use medications properly. Make it easy for help to reach you. These steps are simple, but they are powerful. And they work. If you take nothing else away from this, remember this: doing something is always better than doing nothing. Acting quickly, even imperfectly, saves lives. If you're watching this and you're over 60, take a moment today to prepare. Make sure your phone is accessible. Check your medications. Tell someone you trust where you keep important information. Think through what you would do if symptoms started right now. That preparation could save your life. And if you're watching this for someone you love, share this information with them. Have the conversation. Make the plan. It's not morbid, it's responsible. Because when a heart attack strikes, There is no pause button. There is no second chance to prepare. There is only the moment you're in, and what you do in that moment matters more than anything else.